Good afternoon, everyone. Thank you for attending the second in our exciting new Empowering webinar series. In today's session, we'll be covering templates from the standpoint of editing the source so that each note has the best possible and most versatile content ready to go. We'll look at the basic components and what they do within the new note. My name is Mike Heron. I have been a Tier 2 service and support technician with Complete Healthcare Solutions Incorporated for the past 5 years. We've likely spoken in the past regarding a technical or data issue, and today it's my privilege to be your conference moderator. For those of you who don't know, CHS is an award-winning McKesson/EMD's business partner, providing service and support nationwide for LytecMD, Medisoft clinical and practice partner. You've probably, up until this point, had most of your communication with Kathy Denner, one of our administrators, and you can continue to do so to find out more information about upcoming free sessions, or if you have any additional questions, she will connect you to the correct consultant. You can check on upcoming topics that we'll be covering in this series at www.myemrfix.com. So all lines have been placed on mute to prevent any background noises. Please use the Q&A section in the lower right portion of your screen to submit your questions. We'll be including the most relevant questions that can be answered briefly at the end of the webinar and following up personally on the more involved questions at a later time. If we run out of time or if a question comes to mind later on, you can respond to your conference session invite or send an email to kdenner@mailchs.com. That's KDENNER@mailchs.com. And we will post the answers to all questions anonymously on our myemrfix.com website under training resources. I'll now turn the conference over to our LyTech and LytecMD optimization consultant, Amanda Sawicki. She's one of our premier consultants who knows the effective treatments for the aches and pains of day-to-day EMR use. Over the years, she has helped countless independent practices streamline their workflow to improve patient care. We'll turn it over now to you, Amanda.
Thank you, Mike, and good morning, everyone. I would like to thank you all for joining me today in our second webinar in our Empowering webinar series. In today's session, we are going to cover the elements of a template and some progress note shortcuts. Progress notes, letter templates, and message guides are made up of 10 elements. These elements include label markers, delete markers, required markers, quick text, pick lists, dot codes, insert dot codes, enter label markers, push label markers, and letter codes. Label markers are the building blocks of templates. They are used in creating more than 50% of all the template elements. It is a blue character that you'll see inside of the guides. It is also a placeholder for information to be free texted next to it. Or you can press your tab key on the keyboard to advance through the note without having to click with your mouse. This is an example of a sentence of what it would look like in a note when using label markers. To add a label marker into a note, place your cursor where you would like the marker to go. Then, in the menu bar, click on the Insert button, followed by Label, and it will place the label marker into the note. Delete markers. These are also made up from label markers. This marker deletes lines of text if there is no permanent black text to the right of the delete marker. This is an example of how to use a delete marker within a note. To add a delete marker into a template, place your cursor where you want the marker to be, and then again we're going to go back to that insert menu and click on label. Then once the label is inside of the note, you will use the arrow keys on the keyboard to move inside of the label and remove the asterisk. And then you will type a capital DEL. Required markers, these again are made up from label markers. This marker will turn red when it's in a note, and it will force the user to answer the question or put permanent black text to the right of the label marker inside of the note. You'll see in this example that the label marker is in the middle of the sentence, requiring us to choose an option for how or from where the patient is excused from. To add a required marker into a template, again, we're going to place our cursor where we want to see it. We're going to click on the Insert menu and Label. Use our arrow keys to move inside of the label marker and delete the asterisk. And this time we're going to type in a capital REQ. When we're editing a note, it will show up blue, but once we save it, it's going to turn red. The red will help the end user notice that this is an area where they need to put in permanent text. Once the permanent text is added to the right, either through free typing or the use of quick text, you would be able to save the note. Quick text is used to pull in words, sentences, entire paragraphs that are commonly used in clinical documentation. Quick text that is not clicked on will disappear when the note is saved. They can contain simple text, plain simple text, or they can be more complex and made up of multiple elements of templates. An example of the simple quick text would be this sentence here, where we see the words school and work. When we click on either of those options, it is just going to put in the single word. And then when the note is saved, it would look like this, and the option that was not selected would disappear. An example of a little bit more complex quick text would be this here, where it says patient excuse. And when we click on it, it puts in a whole sentence with quick text options. Again, we'll choose our option, and then it would disappear from the note. To add any quick text into the note, we're going to put our label markers in by going to Insert and Label. It will do this for each quick text that needs to be added into the note. Then, using your arrow keys, again, we're going to move inside and remove the asterisk. And then type in the quick text name. It will do this for each quick text. Then we have to actually build the quick text. We need to build the information that's going to be pulled in when clicking on the blue quick text. So we're going to go to Task in the menu bar and then select Quick Text. This is going to load the quick text dictionary. From here, we will click on New, and we'll get a box for the new quick text. On here, we want to make sure that you're not entering in the provider or practice information. If you do so, the user must be affiliated to that provider and practice to be using that quick text. If you have multiple providers in the office, it can get a little bit tricky to remember whose quick text you are using when you're doing a note. It is best just to not fill those out at all, so it can be used for any user. We will then go into the quick text name and type in that information. This is going to match exactly spelling and punctuation of what you have put into the quick text inside of the label marker on the note. It will auto-capitalize when saving. That is fine. It will not affect anything. Then down in the body of the quick text, you will enter in either the word, the sentence, the paragraph, the additional quick text information that you want to have pulled in when clicking on the first one. and then we will click on Save. You will have to do this for each quick text. Once all of your quick texts have been built, you can close out of the quick text dictionary. Now when we're in the patient's chart and we're doing the note, the quick text items are now clickable, and we'll put in the data that has been built behind the quick text. Pick lists are very similar to quick text. A pick list is a group of quick texts that all start with a common prefix but have a different ending. Pick lists will turn red inside of note, and when they are clicked on, you will have a list format. This is an example of what a pick list would look like, how a note would be indicated that there's a pick list inside of a template. To add a pick list into a note, place your cursor on the line, and we're going to start by putting in our label marker. And again, we'll remove the asterisk and type in our quick text information. At the end of the quick text information, you will add the ellipsis or the 3 periods to the end of the quick text name. This is going to indicate to the system that I want you to look through the quick text dictionary and find everything that starts with the word location and pull it all into one list for us to view. So let's go ahead and now build that list for us. So to build a list, we're going to go back to Task and to Quick Text. Brings us back to the Quick Text Dictionary, where we're going to click on New. Again, make sure you're not filling out that provider practice information at the top of the quick text. And we're going to go ahead and put in the quick text name. So our quick text that we started with was location, so we're going to put that in to the quick text name, but we're going to number our quick text. So by putting a number 1 at the end is going to indicate that this is going to be a different quick text than the next ones that we create. So for location 1, we'll go ahead and we'll put in school and save. And we're going to create a second one. So you'll see in the quick text name we have the word location and then the number 2, and that is going to show us work. And then location 3 will show us sport. Once the note is saved, the quick text, the pick list will turn red, and when you click on it, it's going to pull up this Insert Quick Text box where we now have the 3 options that we just created. You want to select your item and click on Insert. If you would like to select multiple items, hold down your Control key and click on each item and then click on Insert. Dot codes are special codes that can push information out from a note. They do have special formatting, so they must be left aligned and on their own line. They will all start with a period and end with a colon. This example is going to show us 3 different types of dot codes. The first one is a diagnosis dot code, which is pushing out our diagnosis of strep throat with its appropriate ICD-10, ICD-9, and SNOMED code. This will push out to the diagnosis tab on the problem list. The next one we see is the allergy, so this will add a new allergy to the allergy list. And our third example is showing us that it will push out a procedure to the procedures tab on the problem list with the appropriate CPT code. This is the format of what the code should look like inside of a template. For a list of all the complete dot codes, please check the Help menu within the software. Insert dot codes, they are special just like regular dot codes. but these are used to pull data into a note. Just like dot codes, they also have to be left aligned and on their own line. They have a special formatting of starting with a period and a capital I, and they will end with a colon. This example here is going to show us that it will pull in all of the diagnosis codes that are listed under the diagnosis tab on the problem list, pull in all allergies from the allergy list, and pull in all procedures from the procedures tab. This is the format of what the code should look like when building them inside of a template. And again, you can find a list of all of the insert dot codes within the help menu of the software. Next, we're going to talk about the enter label markers. These are new to version 11, and they're pretty awesome things that you can do with these. So what an enter label marker does is it allows data entry from a note without having to use the structure of dot codes. It actually brings up the screen of the field you are entering. It pushes the data out instantly into its respective tab. So this is a couple examples of how an enter label marker would be entered into a note. Enter label markers work for any field that is considered discrete data. To add an enter label marker into a template, you're going to place your cursor on any line and click on Insert and Label. We're going to move inside of that cursor, remove the star, and we're going to put in the formatting for the enter label marker. All enter label markers start with the word enter, has a pipe in between, and then it'll have the tab name of where you're going to push this information out. This formatting is very important, and the formatting can be found inside of the help menu. If we look at this in a note, when we click on the Enter Allergies button, you get the Allergy New screen. It is the exact same screen that you would see when you are in the Allergies section and clicked on the New Allergy button. This next item, again, is new to version 11, and these are called push label markers. And push label markers are used in conjunction with dot codes. They push data out instantly from a note. In this example here, you'll see that we have a diagnosis again for strep throat. And if we were to click on that push button, it would automatically push the diagnosis to the problem list without having to save the note first. This can be used for any dot code. To add a push label marker into a note, you will set up your note to have the dot code line, and the push label must be added at the very end of the dot code. So we'll put our cursor at the end of the line, and we'll click on Insert in the menu bar, and then Label. Again, we're going to go inside, remove the star, and enter the word push. You'll do this for every line. Then when you are using it inside of a note, if you click on push, you will see that it removes the dot code in front of the word strep, and the push is gone as well. When you see that that is removed, it means it has actually pushed the information out to the note. And last but not least, we have our letter codes. Letter codes pull in all the demographic data into a note and custom clinical data. The list of all the letter codes that can be used within the software can also be found within the help guide. Our letter codes are always going to be surrounded by the pipe, and it will always be listed in capital letters. It is very important that the letter code is typed in exactly as it is listed inside of the help guide. This example here shows us what a letter code looks like inside of a template, and it shows us how that letter code will pull the information into the note. If you are typing your patient's full name inside of your practice management software and all capital letters, the letter code will pull the information in all capitals. It will not auto lowercase it. So we've talked about all these great features that you can use to help build your templates up and make them more easy to use on a day-to-day basis. But we all know things go wrong from time to time, and information may not be entered in to be pulled into the note when we start it, or something may have gone wrong when editing a new note and using it for the first time. So what we can do is in Progress Notes, we have this option that will be able to pull data in on command and then let us enter the data entry later. And this is used through the Insert menu. The Insert menu has many features here. We're only going to talk about a couple of them that I think are the most important or the most commonly used within practices. So in here, we have an option to insert individual problems. We can take the previous note and insert it into our current note, add patient education links, pull in the current medications, pull in the patient's problem list, pull in the patient's histories. You can pull them in individually between the social history, the family history, and the past medical history. You can pull in the patient's vital signs and the patient's allergies. We're going to take a look at a live system, and we're going to pull those data fields into a note. You'll see here that I already have my progress note set up for our test patient here, Mickey Mouse. And we're going to go ahead and we're going to pull in some of his individual problems that are on his currently existing problem list. If we go in and click on Insert and click on Individual Problems, you'll see here that it gives us the options for our Major Problems tab, our Other Problems, and our Diagnosis. Select, you can choose any of those tabs, and then highlight the problem you want to add, and click on OK. You'll notice that it puts it in here with the .code structure. This is great because it allows us to not have to look up a problem every time the patient comes in. So if they have a chronic problem, you do not have to search for it each time. You can just insert it automatically from the patient's existing problem list. Previous note, if there's some information that you want to carry forward from the last note to this note, you would click on Insert and choose Previous Note. You can choose from the list of your templates. And when we click on OK, it'll put in the information from our last note. So you'll see here that Mickey was here recently because he wasn't feeling well. So he was diagnosed with strep throat, and he also informed us that we couldn't treat him with amoxicillin. And we also gave him a refill for his Zantac. Patient education. Again, we're going to click on Insert and Patient Education link. What this will do is it will allow us to search through the patient education module to give Mickey some information about his current condition. And it'll link the file right in here into our note, so that way when we're looking at it in the future and we're not sure exactly what education material was given to Mickey, we would be able to review it again. If for some reason the current medication .code did not work when you were inserting or starting your progress note, You can add them later by doing this insert in current medication. Same goes for the problem list. You can choose which tab of information you want to have pulled into the note. You do have to, if there's information on multiple tabs, you do have to come back to this problem list and choose that second or third tab as well. Histories works the same way as the problem list. Each history section is broken out into its individual items, and you can choose from either the default note or the list of notes, or you can do a history template from here. So if we choose from the list of notes, Mickey does not have any social history done right now, but you could see here that the list of items would be listed here by date and by provider, and then you'd be able to insert that into the note. Vitals works very similar to both of those, where the vitals are broken down into different groups. So you can insert vitals from today only. It will not do anything historical that does not match the date of the note. So we can insert his blood pressure and pulse for today. And we can also insert his height and weight. And then last but not least, we can insert the patient's list of allergies. So if we come up here and click on Insert and Allergies, it will list all of the patient's allergies. And then because we clicked on the Allergies Today button earlier this morning, it lets us know that we last updated his allergies today. That concludes our demonstration for today, and I will turn it back over to Mike for questions and answers.
Thank you, Amanda. Great demonstration of the options for customization here. To our attendees, if you feel like your providers are spending too much time in their notes, you're probably seeing a lot of room for adding some of these methods into your workflow, but maybe you have some questions or would like to see a bit more here to help you get started, and we can open that up now. Take a look and see what we have so far for questions and answers. The first one was, will the presentation be made available? And we answered that via the chat window. It definitely will. We'll post the recording shortly after today's session at www.myemrfix.com. So that will be available for you to view. Amanda, I'll ask a first question. As far as all of these tools and tricks that are designed to save time for the providers, what would you say is the most valuable one that is the most underused as you've seen in practices you visited?
That's a really awesome question, Mike. I would have to say that it would be the enter label markers. They were new to version 11, and I think they got overlooked with a lot of the other items that were upgraded. I'm sure everyone here has experienced the pains of the version 11 upgrade and the huge change to RX, which was the most important that everyone was probably trained on and taught how to do. So the templates kind of fell as a back burner. When I've been working with customers since that version 11 upgrade, and we've talked more about templates and how to make them more efficient, we start to include more of those enter label markers because you can do so many things. It's such a powerful tool. One of my favorite enter label markers is the orders label marker. Most clients don't like using orders because they have to leave the note to go put the information in, and it makes it so easy to do it just from that initial screen.
Excellent. So feel free again to post your questions using the Q&A section in the lower right section of your screen. So another question that I can think of, as a busy provider, this is obviously going to take me some time to set up a template if I haven't already done so. And then a year later, I see a lot of room for improvement in the templates I'm already using. I've forgotten really the basics of what to do. How much time is it going to take me to recover in the patient visit the time that I used in the setup of the template? You know, like, when am I going to see a return on investment here in taking less time to give this the same or better patient care?
So on average, if you spend about an hour or two designing your template, you can save more than that in a month with doing the notes within the patient's chart. By making it easier, less clicking, less going into different tabs, less having to pull information in, and everything being designed and developed in the layout that you want, it'll definitely save you hours a month.
That's pretty good. I would put time into that to save that much amount of time in a single billing cycle. Question was raised as far as the email address to send questions after the webinar is over. Obviously, as you dig into doing this, they're going to come up. I'm going to post that for everyone in the chat window here, but we'll also vocalize that you can respond to your conference session invite, or you can email Kathy Denner at the mail address that's in the chat window, kdenner@mailchs.com. All right, well, we have a couple more questions in from a couple of minutes ago. For a family doctor dealing with multiple problems in the same visit, what is the best way to choose multiple templates for visit?
So what you would want to do is to design a generic note that you can create quick text inside to talk about the HPI of each of those illnesses, and also be able to create plans at the bottom for each of those different diagnoses. If you are creating plans, those are usually the lengthiest part of a note. You take the couple of minutes that it takes to put it into a quick text and add it into a single form note. Another thing that you could do is create mini templates where you have a guide for a diabetes problem versus a hypertension problem, and you can then pull each of those templates into one master template.
All right, thank you. All right, another question coming in. So another question that I can think of, as a busy provider, this is obviously going to take me some time to set up a template if I haven't already done so. And then a year later, I see a lot of room for improvement in the templates I'm already using. I've forgotten really the basics of what to do. How much time is it going to take me to recover in the patient visit the time that I used in the setup of the template? You know, like, when am I going to see a return on investment here in taking less time to give this the same or better patient care?
So on average, if you spend about an hour or two designing your template, you can save more than that in a month with doing the notes within the patient's chart. By making it easier, less clicking, less going into different tabs, less having to pull information in, and everything being designed and developed in the layout that you want, it'll definitely save you hours a month.
That's pretty good. I would put time into that to save that much amount of time in a single billing cycle. Question was raised as far as the email address to send questions after the webinar is over. Obviously, as you dig into doing this, they're going to come up. I'm going to post that for everyone in the chat window here, but we'll also vocalize that you can respond to your conference session invite, or you can email Kathy Denner at the mail address that's in the chat window, kdenner@mailchs.com. All right, well, we have a couple more questions in from a couple of minutes ago. For a family doctor dealing with multiple problems in the same visit, what is the best way to choose multiple templates for visit?
So what you would want to do is to design a generic note that you can create quick text inside to talk about the HPI of each of those illnesses, and also be able to create plans at the bottom for each of those different diagnoses. If you are creating plans, those are usually the lengthiest part of a note. You take the couple of minutes that it takes to put it into a quick text and add it into a single form note. Another thing that you could do is create mini templates where you have a guide for a diabetes problem versus a hypertension problem, and you can then pull each of those templates into one master template.
All right, thank you. All right, another question coming in. Where does the green text push from?
So the green text that you would see in a note would be called the E&M code, the Evaluation and Management. We did not get into that today, but you can set up notes to have E&M information associated with your HPI, your review of systems, and your physical exam, and it would help at the end of the note suggest a office level visit. It doesn't push to anything but that evaluation and management tool.
All right, one more coming in. How can I identify the chart information that will be used for CQM?
That question is a little bit more involved, but you could set up a section that a header for all the CQM information to know exactly what information is being used for the CQMs and what is not. Would need to be in a little bit more of a discovery session to find out what CQMs are being used and making sure that the software is set up correctly for those. And if anyone has questions on how to set up their notes for CQM measures, email Kathy Denner and we can set up a follow-up appointment and review that information.
Excellent. So we talked a little bit earlier about the time investment in building a template. I'm going to put you on the spot here. Think of the most complicated template you've ever assisted with building. How long did that take?
The most difficult template that I've ever had to build was an immunization template that tracks everything in the health maintenance. That one did get a little bit lengthy. In time, I would say it probably took me about 5 hours to finally finish it. There were some issues with some health maintenance items were spelled in capital letters, some weren't, some were misspelled, so it took a lot more testing and failing to get to where we needed to be.
Yeah, so just with everything else, I guess you don't really know exactly how much you're getting into when you start, but as you go along, you could run into one of those complicated situations to build.
I see a question that was asked a little bit ago. It is asking if you can make modifications to an existing template, and the answer is yes, any template can be modified at any point. To modify any templates, you can find the list of templates under maintenance templates and note templates, and from there you would select the template that needs to have changes made.
A good one just came in. Is there a way to change multiple templates at once?
You cannot change multiple templates at one time. If you are changing quick text, obviously if the quick text is in multiple templates, it will carry forward to each of those templates. It will not only live in the one that you are creating. However, if you are trying to change something that is hard-coded in a template, you would unfortunately have to touch every single template that it is attached to.
That makes sense. All right, so let's say we're dealing with a patient that has multiple major problems. How would you address that in building a template to accommodate that type of thing?
The best thing to do is to have a section at the top for your chief complaints. There is one that automatically comes with the system. There is one for new problems and chronic problems where it will list out all of the different possibilities or different ailments of a specific problem. So you would start with that. Then as far as the exam goes, even though the patient has 3 or 4 problems, the exam would still all encompass all of those. And then down at the bottom of the, where the plan and the assessment is, you would again have to build quick text to address each of those items. And if anyone is experiencing specific issues with their notes, feel free to reach out to us. We'd be more than happy to take a look and give you a few pointers on what would be best to do in the situations that you are encountering.
Great, well that looks like it's about it. We can wrap up our session for today. Just as a reminder, you can respond to your conference session invite or send an email to kdenner@mailchs.com. We'll post answers to all the questions anonymously on myemrfix.com, as you see on the screen, under Training Resources. There are also archived presentations as well at that website for the previous webinars that we've hosted there as well. So this concludes today's session. Again, we'd like to thank you for joining. You can give us a call at 800-250-8687, extension 110, or email kdenner@mailchs.com. Keep an eye on your email for upcoming sessions. And thanks again, and enjoy the rest of your day.